This morning, in our continuing Bill of the Month partnership with Kaiser Health News and NPR, we are talking about surprise ambulance bills. Last September, an Illinois woman was driving with her brother and her sister when their car collided with a pickup truck. Well, the second shock was when they all received very different bills for identical rides to the hospital in an ambulance.
You think you might have some control over the car, but you don't.
After a car crash, Peggy Dula and her two siblings were transported to the same hospital in 3 separate ambulances. Peggy's injury, a bruised sternum, was the least severe.
And my ambulance bill was $36.06, which I thought was really high.
It was nearly triple her sister's bill.
I couldn't even get anyone to offer an explanation as to the different pricing.
Each ambulance was from a different taxpayer-funded Illinois Fire Protection District and charged a different rate for medical services and mileage driven. Peggy was charged more than double the rate of her siblings' ambulances for medical services and $30 per mile for transportation, while the other two charged $10 per mile.
So I called the paramedic billing service. They basically told me there was little they could do, that the rate was set by the fire district.
Peggy says she's repeatedly tried to contact the Pingree Grove and Countryside Fire District, but the fire chief has not returned her calls.
I felt really powerless, actually, to do anything, to change anything.
Peggy's medical insurance covered 60% of what they deemed to be the reasonable and customary rate for the services she'd received, according to her plan. She was left, that means, with a remaining balance of over $2,700.
I don't have a tremendous amount of money. That's a sizable amount for me.
We are happy to say that all 3 siblings have recovered from their physical injuries. Their financial injuries, though, that's another matter. Peggy Dula says she reached out to paramedic billing services multiple times and tried to negotiate her bill. She also made a $40 payment in good faith. However, the bill was sent to collections. Paramedic Billing Services Vice President, that's Michael Tillman, says patients must dispute charges directly with the ambulance service. All right. The Pingree Grove and Countryside Fire Chief did not respond to our request for comment, but told Kaiser Health News the charges are in keeping with the Federal Ground Emergency Medical Transportation Program, which you've probably never heard of until now. Dr. Elisabeth Rosenthal is editor-in-chief of Kaiser Health News, and she joins us now. Okay, wow.
Yeah, mind-blowing, huh?
It's all mind-blowing because you don't know these costs ahead of time. You get the bill after the fact. So how is it that a company, an ambulance service, can provide the same service as another but charge a completely different price?
Well, because ambulance services can charge whatever they want, and they can join whichever insurance networks they want. And you know what? These days, many, if not most, ambulance services decide to join none.
So what are people supposed to do? I mean, hop on one foot on the corner and wait for like the cheap ambulance to come by? You know, what's the...
Right, Google, are you in my network? You're kind of a sitting duck, and that's really the problem that Peggy faced. I mean, she was the least injured, and she got the biggest bill. And, you know, in retrospect, she should have let her daughter take her to a doctor or called an Uber.
Jeez. So when you call 911, you're not able to ask for the price of the ambulance. That's not part of the conversation.
You're not even able to ask for which ambulance. I mean, basically, 911 goes out, and ambulances, as in this case, just arrive, and you don't know where they're from, whether they're in your network, what they're going to charge you.
When you're actually in the ambulance, on the stretcher there, can you raise your hand if capable and say, please take me to an in-network hospital?
You can ask, but they are unlikely to do so. They take you where they want.
I've always heard when an ambulance shows up, you have to get in. Is there any truth to that?
No. I mean, I always tell people you can say no. Now, the ambulance worker is always probably going to say, better to get checked out, but you might think better to get checked out, but I feel okay. Of course, if you have a head injury or you feel really bad, you should just get in and not worry about the cost. But you know, it's really so unfair to patients, and this is the one thing that was left out of that No Surprises Act.
Yeah.
I mean, you know, out-of-network anesthesiologists, out-of-network air ambulances are in, but ground ambulances, why?
So it was left out of the No Surprises Act. Is that an oversight, or did someone ask for that?
Well, there's some speculation that ground ambulance companies are revenue generators, right, for many local fire departments. So
That makes sense, literally.
Yeah.
it makes sense literally, but it's not great for patients.
Of course not.
Is there any way that a combination of auto insurance with medical insurance can help deviate some of these costs?
Well, 12 states require people to have personal injury protection insurance with their car insurance. In that case, the car insurance health protections kick in first. But for Peggy, that might have helped. But also, we've run a bill of the month where auto insurance, personal insurance protection is very limited, $250,000. If you have a big accident, you can be really out of luck that way. So, you're really out of luck one way or the other.
Great.
Sorry.
Fantastic
Sorry
news.
for the bad news this morning. But
it's realistic. It's what's happening.
really a hole in our legislation, and it's really should be plugged, I think.
Oh, boy.
Thanks for bringing attention to it.
I hope it is. Thank you very much.